Great. Well, the next thing we have coming up is our Lex Leader Forum on the importance of Lex leadership. And so I would like to call to the stage Sharon Overton, Ebony Glover Epps, and Stephanie Aldridge. Right, okay. I just want to tell them something. And I also wanted to mention that I was told that we are at capacity with attendance for this event. So if you have anything in the chair next to you, move it. And if you see anybody looking for a seat, raise your hand and let them know a chair is available, okay? With that, I'm going to hand it to Sharon.
Good afternoon, everyone. I'm Sharon Overton, the Community Engagement Manager on the prevention team at Families Forward, Virginia. Families Forward is now a part of Thriving Families, Safer Children, which is a national commitment to well-being. This is the first of its kind effort of the U.S. Children's Bureau, Casey Family Programs, the Annie Casey Foundation, and Prevent Child Abuse America. 22 states are a part of this effort, and Virginia is one of those states. Virginia is using the innovative approach to provide resources and support for 5 to 7 communities to create, build, and collaborate with community organizations, civic groups, non-traditional service providers, and people with lived experience to develop in the development of family resource centers that focus on advancing primary initiatives. The Family Resource Center will provide multiple services for both children and families, increasing parenting skills and protective factors to reduce the likelihood of formal involvement with child protective services. This will help stabilize families before a crisis reaches a level requiring CPS intervention. We have already sent out an RFA, request for applications, in the month of September, and we have identified 4 communities that we're working with right now during a planning period. We just released another RFA, and we're hoping to get, in February, and we're hoping to get 3 more family resource centers. So if you are here and you are interested in becoming one of those family resource centers, we would be willing to send you out the request for application, and you can apply for one of our grants. Because this is mostly about our Lex leaders and their place in the Family Resource Center, we are requiring them to work with folks who have lived experience in the community. And because this is mostly about that, we're going to turn it over to Ebony, so she's our Lex leader on our team.
Good afternoon, everybody. There we go. Okay. So people with lived experiences bring insight and perspectives that we can't learn from textbooks, gain from professional engagement or research in textbooks. People with lived experiences or Lex leaders have firsthand knowledge of what it's like to work with the child welfare system, the impact it has, and where the gaps are in services, and where the strengths are, for example. Overall, Lex leaders bring valuable insights from their experiences and those in their communities on how we can improve and better service the communities that we live in. When Lex leaders are given the opportunities to connect with their communities, they bring the residents, their perspectives, and their needs to the table, creating a co-design and delivery of services. Seen as experts in our field, Lex leaders help build the gaps between agency and community. They support community members to express their needs, value their community services, and lead more meaningful interactions between service providers and the communities they serve. Less leaders can provide hope and inspiration for other community members. As individuals with lived experiences, we advocate for, are actively involved in, and serve as models of resiliency to those who may be going through, have gone through, or know someone who could relate to challenges with the child welfare system. Having someone available that has overcome the complexities of the child welfare system can be empowering and uplifting and offer a sense of hope. My experiences with the child welfare system includes being a single child, an only child to a single mother who used substances as a way to cope with mental health, depression, and poverty. I was exposed and experienced a great deal of trauma before my teen years, and I myself became a teenage mom while I was still in high school. I married a man who was abusive and who attempted to take my life at least twice. I lost custody of my children when I attempted to leave him. Due to the false accusations he made when I left. I learned to work heavily with the guardian ad litems, domestic violence workers, school social workers, teachers, CPS workers, and the court system while I fought to resume custody. Out of all the trauma I had ever experienced, none really broke me like losing custody of my children. I never considered that that could happen to me. I wasn't abusive. I didn't use drugs because I'd seen the impact. I wasn't neglectful. I felt like I was nurturing. I was involved in my children's lives. And before leaving my ex-husband, I was working as a teacher. So my life seemed pretty normal. Overall, when I went to get help after losing custody of my children, the thing that kept coming up for me was, how did this happen to me? And all the agencies that I went to had the same questions. How did this happen to you? What is it that you're not telling us? What else is it? But it really was just that. So I quickly learned that there weren't any supports big enough or involved enough to help me with my situation. So I had to learn how to take what I could from every resource that was available to me and all the supports and kind of try to piece together what I could to kind of fight the court systems for my children. There was a lot of times I didn't even have the energy to breathe, let alone fight. What I was going through was challenging, but was even worse is that I felt like no one understood me and there was nowhere I could go for help, and that was heartbreaking. Through my fight, I met women and other families in my situation. My therapy and breath became supporting other women like me and trying to prevent them from being like me. I started volunteering, working in the domestic violence center. I started working with mental health and substance abuse. I worked with women and providers, the courts, CPS, and judges to help better support women like me and families, and I kind of walked the journey with them. Aside from a few people, no one really knew my story and how each woman and each family that I worked with, each family that I helped to fight, I fought to reunite, and each woman that I helped become stronger was also a fight for me and my own family. In addition to my work, I built some really good relationships on the way and watched some wonderful women restore their lives. Eventually, almost 5 years later, Judge Rogers in Roanoke, Virginia, ordered me to resume custody of my children. I had been in this court many times to testify for other women. I had worked with CPS many times, but the courts and CPS never knew that I was fighting my own personal battle. I went to school and finished my bachelor's degree and my master's degree in mental health counseling. And I vowed to continue this work because I know what it's like to lose hope. And I know what it's like to experience or to have the experience that nobody else cares, that nobody can help. I know what it's like to feel hopeless. And so And so I vow to work with women like me, and I'm just committed to this service. As an individual, I can only do so much. But together, co-creating with our communities, we can support, empower, and build resiliency all across the Commonwealth. Today, I have brought with me Stephanie Aldridge, who was a lady that I worked with when I was at Project Link. Years later, when I came to Families for Virginia, I was able to connect with her, and I was really excited to bring her on with us here today. Stephanie is a loving mother of 3 and a beautiful wife, and I'm going to turn this over to Stephanie.
Hello, my name is Stephanie Aldridge, and I'm going to share a little bit of my story with you. In 2017, my 18-month-old daughter and my 1-month-old son entered foster care due to my husband and I being homeless and our drug addiction. After they entered foster care, I was given the binder of the year timeline and all the services I was expected to complete. It was after I viewed that binder, I immediately felt broken, defeated, just beaten, and I just thought it was going to be impossible for me to ever regain custody of my children, so my addiction became much, much worse after that. It was so hard for me to wrap my mind around that year timeline. It was going to take a year for me to regain custody of my children. You might as well have been telling me an eternity. It wasn't until 8 months after my children were removed and my addiction spiraling out of control that I made the first step to get help. So I found an inpatient rehab where I completed 30 days. Once getting out, I immediately started Project Link, and that is where I met Miss Ebony. I can honestly say that she was the first professional that I came across who believed in me, who made me feel loved and encouraged me, who thought that I wasn't fighting a losing battle. So I'm really thankful for her. She gave me so much encouragement, and she's a big piece of why I'm here today. Shortly after I got out of rehab and started Project Link, I came up on the review hearing for my children. It was there the guardian ad litem said, while she thought it was great that I had completed inpatient rehab and finally produced clean drug screens, it had taken 8 months to do so. My children were happy and thriving with the foster family, and it was going to be her recommendation that day that they terminate my rights. Thankfully, the judge said she did not agree as long as I could stay clean and I found housing that they would proceed with the return home goal. That day, I knew I had to do everything and anything I could to get my life back on track. I signed up for Healthy Families, which she was for my newborn baby, but I would say she was a wonderful worker as well. She helped me with all my children. So, Healthy Families, I love you guys. I signed up for parenting classes, individual counseling, marriage counseling, continued outpatient treatment services, a parenting coach who I had to spend 30 plus hours a week with, a mental health skill builder who I also spent 20 hours a week with. And it was my mental health skill builder who helped me find housing. She got me into an apartment building that had a 2-year waiting list and only 6 days after I filled out my application. After the foster parents found out we had obtained housing, they started to realize that the children that they thought they were adopting were now going home. After we started getting extended visits at our apartment, we also began play therapy with my daughter, and we had in-family counseling at home as well. So needless to say, my life was a little chaotic. I was learning how to be a mother of 3 small children after only having to be with myself for over a year. And the foster mother added a lot of stress to that situation. She began to question myself and neighbors about my sobriety, my ability to even be a mother, about who was coming in and out of my house. But I knew I could not be mad at her. She was in that fight or flight zone just like I was the day I learned my kids were leaving my care. So although I didn't agree with some of her decisions, I know it was coming from love. She loved my children. After completing the services that were required of me and maintaining my sobriety for a while, they were ready to return custody, but I was afraid of not having that accountability of my foster care worker. So I asked them to please stay in my life a little longer. I'm sure you guys don't hear that very often, but they agreed and they extended my case out 3 more months. After I regained my custody, I obtained my Certified Peer Support Specialist certification from Sarah here in Richmond. And today I have a good relationship with DSS. I sit on the Roanoke County FAP team where I meet other women who are currently going through the same situation I experienced with foster care, or other women who just have an ongoing case. I feel it's very important to have someone in your corner to advocate for the right services, who actually knows what you've been through and knows the pain of just struggling and hurting every day. Because honestly, when I was going through that, I felt like no one understood me, until I met Miss Ebony, and now she was going through the same thing, and that's why I connected with her so deeply. Helping these ladies succeed in their sobriety and seeing the reunification of their family is really where my heart lies. It keeps me going and forever thankful, because I will never forget who I used to be and how much I was able to overcome so I could be the mother my children deserve to have today. I am also on the Parent Advisory Council for Virginia Department of Social Services. I am 5 years, 7 months sober, and my children have been home for almost 5 years. Thank you. Thank you. My family and I still have therapy in place today to try to overcome some of the past traumas that are still lingering. My daughter cannot be left alone for extended period of time. She doesn't want to stay the night anywhere. If I come to these events, they have to come with me. So there's that, separation anxiety, not only for them, but for me as well. We also still have a relationship with the foster parents. She is a big part of my son's life today. While I know that I didn't agree with her decisions, she was like the bio mother to my son, because he was just a baby when he was taken. So that's who he knew as mommy and daddy. So it was a really hard adjustment for him when he came home, and I couldn't watch him stand there and cry for her. So he still sees them on the weekends. She's Mommy A, and I'm Mommy Stephanie. I've been asked at a lot of these conferences, what is my takeaway in this? And I just ask you, please don't count out your bio parents. You may think they're never going to change. The children are happier where they are because the foster parents have money and they can provide things, but that's not always the case. You know, God does work miracles, and I'm proof of that. And I'm just really happy to have my family back today. Thank you.
So Stephanie's story is so important because not all stories end the way Stephanie's did. Stephanie was resourceful. She worked to build a network and a support system. What we've witnessed is that not everybody's capable of doing that. What we've also witnessed is that everybody doesn't have the means to do that or to achieve that kind of outcome. So this is why Blake's leadership is so important and so essential. We know our communities. We know where the gaps are in services. We know the work that needs to be done. But most importantly, we're connected to our communities. We live in those communities. We work in those communities. We know the people and their stories. We're essential in bringing their voices to the table, supporting them, empowering them, while modeling inspiration and supporting hope. Overall, working with Blake's leaders is essential to ensure that the services and the systems we co-create and design are responsive to the needs of the community, respectful to the members of the community, and effective for all those who trust us with their well-being. Questions? Or reactions. Any questions about the FRCs for Sharon? Well, I just want to thank you guys so much for letting us come here today. Thank you so much, Stephanie, for coming here with us. We so appreciate you.
Thank you for having me. Thank you.
We have the next track that's going to be starting at 1:15, and it will consist of 3 sessions. The first session will be abuse prevention for kids with disability with LEAP. LEAP stands for Leadership for Empowerment and Abuse Prevention. And that will be in Shenandoah Parlor A and B. The next session will be Blueprints for Change, from knowledge to action, and that will be in Shenandoah Parlor C. And that would be Dr. Beagle is doing that one. The last one would be Strategies for Human Trafficking, Prevention and Identification, Overview of Human Trafficking Assessment and Prevention Response, and that will be in Shenandoah Parlor D. After that, we'll have a 15-minute break, and then we will come up with our last track, which will be Fostering Community Resilience, Virginia Guidelines for the Primary Prevention of Sexual and Domestic Violence. That will be in Shenandoah A and B. The next one will be Handling Stress and Professional Burnout. That will be in Shenandoah Parlor C. And then Substance Use Disorder and Child Welfare. That will be in Shenandoah Parlor D. Another break, which would be at 4 to 4:15. And then we will have our closing remarks will be held in here, and that will be Nancy Fowler, okay, and Mia Crockett. Thank you.